Tonight in Medical Rounds, the statistics say it all. Men are 1.4 times as likely as women to die from almost every chronic medical condition and on average live 5 years less than women. Now, getting a man to go to the doctor is hard enough, but sometimes it helps to hear it from a doctor who's been there. Joining us live from Hartford Hospital is John Griffith, a urologist with the Hartford Healthcare Kidney and Urology Institute. Doctor, thank you so much for being with us.
Good evening. Thanks for having me.
So first, let's start off with BPH, or benign prostate hyperplasia. That's the formal term for an enlarged prostate. Nearly 20% of men in their 40s are dealing with this, but they don't always seek help. What is it?
So BPH is a benign condition that is quite common in men as we age. Typically, it can present with bothersome urinary symptoms such as urinary frequency, urgency, waking up often at night, or sometimes painful urination.
Now, what are some of the treatments you offer for BPH at Hartford Healthcare?
Initially, we always focus on behavioral modifications that hopefully will assist in these bothersome symptoms, but there are also medications available that are quite effective in dealing with these symptoms as well. And in cases that persist, there are also surgical interventions that are offered throughout our healthcare system, including transurethral resection of the prostate, a UroLift procedure, and sometimes even a prostatectomy for very large prostate glands.
And can you take us through the process? Once a man enters the Tallwood Men's Health Center, how is his care coordinated through all of these different services?
Certainly. Initially, our focus is on preventative measures. It's important with men who may not have seen a primary care physician recently to go through preventative measures to make sure that they've received their proper screening. And then we have a nurse navigator that assists in coordinating care across the different specialties within our healthcare system.
And doctor, in regards to men's sexual function and men's sexual health, what do you want them to know?
I think it's most important for men to understand that they're not alone. These problems, whether they're erectile dysfunction, premature ejaculation, decreased interest in sexual activity, all of these problems are quite common, and I really think it's important for men to understand that they are not alone, and it's important to seek care from their primary care provider as well as from a urologist in regards to these problems.
And lastly here, and quickly, based on what you see with your patients, why do you think men have such a difficult time committing going to the doctor?
I think everyone's life is very busy, and often it ends up low on a list of priorities for many patients. But I really would encourage them to place it higher up on this list and see their primary care provider and reach out to us at the Tallwood Institute to help with all of these problems.
All right, Dr. Griffith, thank you so much for your insight tonight. We greatly appreciate it. And Dr. Griffith has a free community education class open to the public. That's coming up on September 4th at the Ellington Senior Center. For more information, all you have to do is call the Hartford Healthcare Tallwood Urology and Kidney Institute and choose option 1 for men's health.